Sexually transmitted diseases, or STDs, are infections that pass from one person to another through sexual contact. These infections can be caused by bacteria, viruses, or parasites. They are typically spread through vaginal, anal, or oral sex, but some STDs can also be transmitted through non-sexual means, such as blood transfusions or shared needles. This usually happens during vaginal, anal, or oral sex. It's important to understand that STDs can affect anyone who is sexually active, regardless of age, gender, or sexual orientation. STDs are a common health concern, and anyone who is sexually active can get an STD. In fact, millions of new STD infections occur every year worldwide. Some of the most common STDs include chlamydia, gonorrhea, syphilis, herpes, human papillomavirus, HPV, and HIV/AIDS. STDs can cause a wide range of symptoms, from mild discomfort to serious health problems. Symptoms can vary depending on the type of STD, but they often include unusual discharge, sores or bumps, itching, and pain during urination or sex. However, some STDs may not cause any symptoms at all. Some people may not even know they have an STD because they don't have any noticeable symptoms. This is why regular testing is crucial, especially if you have multiple sexual partners or engage in unprotected sex. However, even without symptoms, STDs can still be spread to others. This makes it essential to practice safe sex, such as using condoms and dental dams, and to have open and honest conversations with your sexual partners about your sexual health. That's why it's important to learn about STDs, how to protect yourself, and when to get tested. Early detection and treatment can prevent serious health complications and reduce the risk of spreading the infection to others. Taking care of your sexual health is just as important as taking care of your overall health. By staying informed, practicing safe sex, and getting regular checkups, you can protect yourself and your partners from STDs and lead a healthier, happier life. STDs, or sexually transmitted diseases, are primarily spread through sexual contact. This includes vaginal intercourse, anal intercourse, and oral sex. When engaging in these activities, bodily fluids such as semen, vaginal fluids, and blood can carry infectious agents from one person to another. Even skin-to-skin contact with an infected area can result in transmission of certain STDs, such as herpes or human papillomavirus, HPV. It's important to remember that anyone who is sexually active can get an STD, regardless of their age, gender, or sexual orientation. STDs do not discriminate and can affect people from all walks of life. Whether you are young or old, male or female, straight or LGBTQ+, if you're sexually active, you are at risk. This is why regular testing and open communication with your partners are essential. While sexual intercourse is the most common mode of transmission, some STDs can also spread through other means. For instance, certain infections can be transmitted through non-sexual routes, such as blood transfusions or organ transplants. Additionally, some STDs can be spread through contact with infected bodily fluids in healthcare settings if proper precautions are not taken. For example, certain STDs can be passed from a pregnant woman to her baby during pregnancy or childbirth. This can lead to serious health complications for the newborn, including infections, developmental issues, or even stillbirth. Pregnant women should be routinely tested for STDs to ensure the health and safety of their babies. Sharing needles for intravenous drug use is another way STDs can be transmitted. When needles are shared, blood from an infected person can be introduced into the bloodstream of another, spreading infections like HIV and hepatitis. It's crucial for individuals who use intravenous drugs to use clean needles and never share them with others. It's important to note that STDs cannot be spread through casual contact like hugging, shaking hands, or sharing utensils. Everyday interactions such as touching, kissing on the cheek, or sharing food do not pose a risk for STD transmission. Understanding this can help reduce the stigma and misconceptions surrounding these infections. Understanding how STDs are transmitted is crucial for taking steps to protect yourself and your partners. By being informed, practicing safe sex, getting regular screenings, and having open conversations with your partners, you can significantly reduce your risk of contracting or spreading STDs. Knowledge and prevention are key to maintaining sexual health and well-being. Chlamydia is one of the most common STDs, especially among young people. It's caused by a bacterium called Chlamydia trachomatis. Many people with chlamydia don't have any symptoms, but some may experience pain during urination, unusual discharge, or pain in the lower abdomen. If left untreated, chlamydia can lead to serious health problems, particularly for women. It can cause pelvic inflammatory disease, PID, which can damage the reproductive organs and lead to infertility. The good news is that chlamydia is easily treatable with antibiotics. If you think you may have been exposed to chlamydia, it's important to see a healthcare provider for testing and treatment. Early detection and treatment are key to preventing long-term complications. Gonorrhea is another common bacterial STD. Like chlamydia, it's often asymptomatic, meaning people may not experience any symptoms. However, when symptoms do occur, they can include pain during urination, unusual discharge, and pain in the lower abdomen. Untreated gonorrhea can also lead to serious health problems. In women, it can cause PID. In men, it can lead to epididymitis, a painful inflammation of the testicles. Gonorrhea can also infect the throat, rectum, or eyes. Similar to chlamydia, gonorrhea is treatable with antibiotics. It's essential to seek medical attention if you suspect you may have gonorrhea to receive timely treatment and prevent complications. Syphilis is a bacterial infection that can have serious health consequences if left untreated. It typically progresses through several stages, each with its own set of symptoms. The first stage often involves a painless sore called a chancre, which may appear on the genitals, rectum, or mouth. If left untreated, syphilis can progress to later stages, causing a rash, fever, swollen lymph nodes, and other symptoms. In its late stages, syphilis can damage the heart, brain, and other organs. Fortunately, syphilis is treatable with antibiotics, especially in its early stages. Regular testing is crucial for detecting and treating syphilis early, preventing its progression and potential complications. Herpes is a viral infection that causes sores and blisters. There are two main types of herpes simplex virus, HSV1, which usually causes oral herpes, commonly known as cold sores, and HSV2, which usually causes genital herpes. Both types of herpes can be spread through sexual contact. Herpes is a lifelong infection, but antiviral medications can help manage outbreaks and reduce the risk of transmission. While there is no cure for herpes, understanding how to manage the virus is essential. Antiviral medications can suppress outbreaks and reduce the risk of transmission to partners. HIV, or human immunodeficiency virus, is a virus that attacks the immune system, specifically targeting CD4 cells, which are a type of white blood cell that plays a major role in protecting the body from infection. When HIV invades these cells, it uses them to replicate itself, eventually destroying them in the process. This gradual destruction of CD4 cells makes it increasingly difficult for the body to fight off infections and certain cancers that it would normally be able to resist. Over time, the immune system becomes severely weakened. HIV is spread through contact with infected bodily fluids, which include blood, semen, vaginal fluids, rectal fluids, and breast milk. The most common ways the virus is transmitted are through unprotected sexual contact, sharing needles, and from mother to child during childbirth or breastfeeding. It's important to note that HIV cannot be spread through casual contact, such as hugging, shaking hands, or sharing food or drinks. The virus does not survive well outside the human body, so it cannot be transmitted through air or water. If left untreated, HIV can lead to AIDS, which stands for Acquired Immunodeficiency Syndrome. AIDS is the final and most severe stage of HIV infection, where the immune system is so badly damaged that the body struggles to fight off even the most minor infections. People with AIDS are at high risk for opportunistic infections, which are infections that occur more frequently and are more severe in individuals with weakened immune systems. These can include infections like tuberculosis, certain types of pneumonia, and some cancers. AIDS is the most advanced stage of HIV infection, and it makes the body highly vulnerable to opportunistic infections. Without treatment, people with AIDS typically survive about 3 years. While there is no cure for HIV, there are effective treatments available that can significantly slow the progression of the virus. These treatments, known as antiretroviral therapy, ART, help reduce the viral load in the body to undetectable levels. By taking ART consistently, people with HIV can maintain a low viral load, which helps keep their immune system functioning and reduces the risk of transmitting the virus to others. There are effective treatments available that can significantly slow the progression of the virus and help people with HIV live long and healthy lives. With proper medical care, HIV can be managed as a chronic condition. Early detection and treatment are crucial for managing HIV and preventing the development of AIDS. Regular testing and early intervention can make a significant difference in the quality of life for those living with HIV. People with HIV who adhere to their treatment plan can achieve a near normal life expectancy. They can work, exercise, and enjoy a fulfilling life, just like anyone else. Early detection and treatment are crucial for managing HIV and preventing the development of AIDS. Regular testing and early intervention can make a significant difference in the quality of life for those living with HIV. Preventive measures, such as using condoms, getting tested regularly, and taking pre-exposure prophylaxis, PrEP, if at high risk, are essential in reducing the spread of HIV. Education and awareness are key in the fight against this virus. Preventing STDs is crucial for protecting your sexual health. One of the most effective ways to prevent STDs is to practice abstinence. This means not engaging in any sexual activity. For those who are sexually active, using condoms consistently and correctly is essential for reducing the risk of STD transmission. Condoms provide a barrier that can help prevent the exchange of bodily fluids. Another important prevention strategy is to get tested regularly for STDs, especially if you have new or multiple sexual partners. Regular testing allows for early detection and treatment, preventing the spread of infection. Taking charge of your sexual health is paramount. If you are sexually active, it's essential to get tested for STDs regularly. Many STDs don't cause noticeable symptoms, so regular testing is the best way to know your status. If you test positive for an STD, it's important to seek treatment promptly and follow your healthcare provider's instructions carefully. Remember that STDs are treatable, and early intervention can prevent long-term health complications. By prioritizing your sexual health, you are taking a proactive step towards a healthier and happier life.